little pill.
It's the daily routine that keeps Ada Dominguez's multiple illnesses in check. She's off on disability and only some of the drugs are covered by the government, and that leaves her with some tough financial choices.
I had to balance it, and that's to buy medicine. It's a balance, it's a struggle for me to do.
We pay the second highest drug prices in the world, and an estimated 3 million Canadians can't afford their prescriptions. This doctor sees the consequences of that all the time.
We see people who don't have control of diseases that could easily be controlled with medications: diabetes, high blood pressure, HIV.
Prasad and his colleagues developed a list of 125 drugs, basic medication for the most common conditions. It's modeled on the WHO's list of essential medicines, for which many countries already pay.
So there are now essential medicines programs in many developing or low-income countries, but there's not one in Canada.
In a related paper, researchers estimate if most of these drugs were publicly funded, they'd be 4 times cheaper, $4 billion worth of prescriptions for just $1 billion. And they point to the way provincial governments buy meds in bulk for seniors and low-income patients, and that gives the provinces discounts. But this health law expert says the provinces are still paying more than foreign governments because they refuse to play hardball with drug companies.
Instead, they've come together and agreed that they're going to pay specific fixed prices that are just about the highest in the world. It's a monumentally stupid way of doing things, and it's the Canadian way of doing things, and we need to fix it.
As for the health minister, she says paying for essential medicines is a reasonable proposal, but not until the prices for them come down.
If we were someday as a country to be able to have a universal pharma-care program, it would be impossible to get there without doing this important work that we're undertaking at the very present time.
Part of that work, according to the minister, is changes she promises to make at a little-known federal agency that sets the prices for patented drugs. Changes, she says, that will save Canadians billions of dollars. But that's of little comfort for out-of-pocket payers who need basic generic drugs, for which companies can still charge whatever they want. Vic Adopia, CBC News, Toronto.